Welcome to this edition of COVID Talks. Today I have the pleasure to talk to Dr. Pablo Requena. Dr. Requena is at the same time a Catholic priest and a physician. Dr. Requena teaches moral theology at the Pontifical University of the Holy Cross in Rome. And Dr. Requena is also the representative of the physicians at the Vatican in the General Assembly of the World Medical Association. Welcome, Dr. Requena.
Good morning, and good morning to all the friends of the World Medical Association.
Professor Requena, what we have seen from Italy is a very dire situation. How are you experiencing this situation in Rome?
Well, this is a very difficult situation here, as you all know, because we are already for more than 2 weeks enclosed at home. At the beginning, it was just that we stopped lessons at the university, but then in a few days we realized that we had to be completely enclosed, and this is why we are right now trying to keep the lesson as kind as we have with the students at the university. But as you know, in Italy there are many cases, mostly in the north of the country. And we hope that the measure the government has decided can stop the epidemic.
Yesterday, I have seen on TV that the Holy Father was giving the blessing Urbi et Orbi at the completely empty Peter Square. This is totally unusual. Usually there are 100,000 people, and it's also unusual that he gives it at this day, because usually that blessing is given on Easter and on Christmas time. So what we have is a situation that people cannot gather anymore in their churches. And I assume also pastoral care is extremely difficult. We have seen patients dying completely alone on the wards. What does that mean when in times where usually people are gathering in churches, they cannot go anymore and they don't get the pastoral care they need?
Yeah, well, as you said before, the prayer of the Pope yesterday was very impressive. I think that he was in a hurry to give this benediction that, as you mentioned, is a normal benediction for the Easter day. But I think he decided to give another one yesterday to all the world, all the people, and not only the people who were following the blessing by the technologies, but also to receive this benediction even if they could not be connected with any of these means. I guess this image will remain as an historical symbol of this pandemic, because it was very strange to see all the St. Peter's Square completely empty, and the Pope preaching and praying to all the world, because it's clear that many millions of people were following this prayer, in which I think he tried to give some consolation and some insights to think about everything that is going on in these days. And then, as you mentioned before, we have a very big challenge for pastoral care, in the sense that we cannot go to be closer to the people. What I am saying these days is that the pastoral imagination of the priest is working a lot, and you have many initiatives to try to get close to the people using technologies and trying to be in contact with the people. I think this time is also important because it reminds us that we can also pray in our room, as Jesus said, and we have these many other possibilities to pray and to reflect in these difficult moments.
Most of us esteem the spiritual care that patients can get at the hospital when they are very sick by a priest, by a chaplain, very highly. Now, in these times, can this be replaced? Is there a chance that this can continue?
I think we have many different situations, and in some places you have, as the people in the hospital, the pastoral worker and the priest who continue to work and to assist the ill people. But as you mentioned before, it's maybe one of the most sad situation these days is that many of the ill people are alone and are dying alone. And this is something that made me think a lot these days. I don't know if it would be possible with this infection to do as we have seen in the historical pledge, in which when one people overcome the disease could help the sick as volunteers. I don't know if this is possible and healthy for them, because this could be a very good way to help all these people who see the doctor maybe once a day and the nurse just 2 or 3 times a day. But I don't know if it could be possible to figure out some kind of help with volunteers, people who have overcome their disease.
There have been very nice initiatives of people trying to reach out to, for instance, homeless people, for those who have now difficulties to find shelter when everybody is told to stay at home. That's very difficult if you don't have a home. I've seen initiatives where people are trying to bring food to those people, which is also difficult because you cannot have contact directly. So there are building places where you can exchange and can give and so on, which certainly is something that is very much in a Christian spirit, to share and to deliver with that. I can only hope that those initiatives are continuing and show that these times also help to build again a sense for community.
Yeah, I have seen many initiatives, for example, in Spain, of people written letters to the people who is in the hospital, and the doctors, when they go to visit the patient, give them this letter from people they don't know, but they are letters to be close to all these people, and letters that give a bit of comfort and to understand that they are not alone fighting this fight.
Now, for you as a teacher, you said that you have stopped very early in the university to have classes. Do you still go on electronically to communicate with your students and to continue teaching, or has that been stopped for now?
No, we are continuing with the lesson as much as we can, and also we are changing the style of teaching, of course, but trying to continue the academic year with some online lessons and some also readings and exchange with the students in order to try to arrive to the end of the academic year and take advantage of the technologies.
Professor Requena, thank you very much for this talk.
Thank you.
And I think we all hope that this gets over quite soon. Thank you.
Thank you.